Welcome to this space dedicated to the dissemination of scientific knowledge, designed for medical specialists, students, and the general public interested in health. Today, we will analyze a fundamental research paper titled Imaging Diagnosis of Subclavian Steal Syndrome, Secondary to Takayasu Arteritis, Affecting a Left Side Subclavian Artery. This important article was developed by researchers Roldan Valadez, Hernandez Martinez, Osorio Peralta, Elizalde Acosta, Espinoza Cruz, and Casian Castellanos. Originally published in 2003 in the journal Archives of Medical Research, this study offers us a critical perspective on Takayasu Arteritis, TA, a rare form of chronic, occlusive, large vessel vasculitis that primarily involves the aorta and its main branches. Through this clinical case, we will discover how this disease can lead to subclavian steal syndrome, SSS, a hemodynamic phenomenon where blood flow is reversed in the ipsilateral vertebral artery to sustain the blood supply to the arm. Join us as we explore how the use of advanced imaging technology, such as Doppler ultrasound and digital subtraction angiography, allows for an accurate diagnosis and timely treatment, such as balloon angioplasty and stent placement, to significantly improve the patient's quality of life. Legal disclaimer: this material is for educational and scientific dissemination purposes only. Its goal is to democratize access to the knowledge generated in specialized academic publications. Due to the dynamic nature of medical science, the information presented reflects the data available at the time of the original article's publication and may be subject to subsequent updates. Not medical advice. Under no circumstances does the information presented constitute a medical recommendation. The graphic resources used are only a representation of the article presented and are not completely accurate to human anatomy. For more information, you may pause the video.
All right, today we've got a really wild medical case for you. It's a story that took 17 years to solve, a real head-scratcher, full of baffling symptoms, some seriously clever detective work, and a bizarre phenomenon where one part of the body literally starts to steal blood from the brain.
I mean, it sounds like something out of a sci-fi movie, right? But believe it or not, this is a very real and very strange thing that can happen based on the simple physics of how blood flows. And this one question is the key to unlocking this entire medical mystery.
So, let's meet our patient. We're talking about a 32-year-old woman who, by the time she was admitted for this, had been on a long and really frustrating journey through the medical system, dealing with a whole collection of problems that just didn't seem to be connected at all. So get this, the whole puzzle started when she was just 15 years old, with these sudden attacks of dizziness. Then, over the next 17 years, she started getting neck pain that would come and go, and something called claudication, which is this severe cramping pain in her left arm, but only when she would exercise. By the time she was finally admitted, she was also dealing with intense vertigo and Raynaud's phenomenon, where your fingers turn white and blue when it's cold. Dizziness, neck pain, arm pain, weirdly colored fingers. I mean, how could all of that possibly be connected? Well, the investigation starts where it always does, with a simple physical exam. And it's right here that the doctors uncovered the first huge clues that pointed away from a bunch of separate issues and toward one single underlying problem with her blood vessels. Okay, so check this out. The most critical clue was the massive difference between her two arms. Her right arm? Totally normal. Vitals were fine. But on her left side? It was like the circulatory system was a ghost. They couldn't feel a pulse, not at her wrist, not further up her arm, not even in her neck. This wasn't a nerve issue. This was a plumbing problem. Blood just wasn't getting where it was supposed to go.
So, with the physical clues basically screaming blockage, the medical team turned to advanced imaging. They needed to see inside her arteries to literally draw a map of her circulation and figure out exactly where the system was failing.
Their first tool was a Doppler ultrasound. The easiest way to think about it is like a weather radar for your bloodstream. It's totally non-invasive, and it lets you see not just if blood is flowing, but more importantly, which direction it's flowing. And that little detail, it would turn out to be everything. And here it is. This is the smoking gun. The ultrasound showed that in her left vertebral artery, an artery that is supposed to flow up into the brain, the blood was actually flowing backward. It was going the completely wrong way down a one-way street. This was the first definitive sign that a steal was happening. Now, to confirm this and just get a crystal clear picture, they brought out the gold standard, digital subtraction angiography, or DSA. This is where they inject a special dye that makes all the blood vessels light up on an X-ray, basically creating a perfect roadmap of her entire circulatory system. So, with the exam results and all this imaging data, the team finally had all the pieces of the puzzle. They could now explain, without a doubt, the bizarre phenomenon that had been causing all her symptoms for almost 2 decades.
Okay, let's walk through how this steel actually works. Think of it like a crazy traffic situation in your body. First, the main artery to the arm, the subclavian, gets a narrowing. It's like a lane closure on a major highway. Second, when she uses her arm, it demands more blood, creating a huge traffic jam right at that narrowing. This makes the pressure drop right after the blockage. So the body, in a desperate attempt to find a detour, does something incredible. It reverses the flow in the nearby vertebral artery, pulling blood away from the brain to feed the arm that's starved for oxygen. Her arm was literally stealing blood meant for her brain. No wonder she was getting dizzy.
The angiography confirmed the source of that traffic jam, a 30% stenosis or narrowing in her left subclavian artery. Now I know what you might be thinking, 30%? That doesn't sound like a lot, right? But in this specific spot, it was more than enough to set off this entire bizarre chain reaction and cause all those debilitating symptoms.
And yep, this whole condition has a name: subclavian steal syndrome. It perfectly connects the dots between the plumbing problem, that subclavian narrowing, and the neurological symptoms like her vertigo. The dizziness wasn't some separate issue, it was a direct result of the steal. But one question was still hanging out there. What caused the artery to narrow in the first place? And this was the final piece of the puzzle. The root cause was Takayasu Arteritis. It's a really rare autoimmune disease where the body's own immune system messes up and starts attacking its largest arteries. This inflammation damages the artery walls, causing them to get thick and narrow. And it most commonly affects young women, a perfect match for our patient's profile. After 17 long years, they finally had the complete answer.
So, the mystery is solved. Now what? Well, this is the best part of the story. The fix. With a complete diagnosis and a clear map of the problem, the medical team knew exactly what to do.
And the solution was actually pretty amazing. Using a procedure called balloon angioplasty, surgeons guided a catheter all the way to that narrowed spot in our artery and placed a stent. This little mesh tube acts like a scaffold, propping the artery open. And just like that, the traffic jam was cleared and normal blood flow was restored to her arm.
The results were pretty much immediate and just dramatic. This quote from the actual case report says it all. After the procedure, the vertigo that had been a part of her life for 17 years was gone. The awful arm pain was significantly better. The blood flow thief had finally been stopped.
You know, a case like this is a powerful reminder of how important it is to keep digging and to connect clues that seem unrelated. It really makes you wonder what other profound answers are out there, just hiding in plain sight, waiting for someone to connect the dots.
The reference for the article from which this information was extracted is displayed on the screen. Thank you very much for your attention and for joining us until the end of this analysis. If you found this review helpful, we invite you to share it with colleagues, residents, students, and anyone interested in these topics. Don't forget to subscribe and turn on notifications. This material is for educational and scientific dissemination purposes only.